Doctors found what growing inside his nose for the past few months. A 38-year-old man in New York had breathing issues. He had problems inhaling from his right nostril and it was causing him restlessness. He decided to take the matter to Dr. Khanna at Cleveland Clinic. The man said that he has been having trouble for years, but it only got intense in the last few months. Doctors believe that it was a case of a deviated septum. In simple words, the cartilage responsible to separate the two nostrils loses its shape due to some injury or hereditary reasons. The doctors referred some normal tests to the man and thought it was just any regular case. While the doctors were performing rhinoscopy, they found something that shocked everyone. Rhinoscopy is a method to see inside of someone's nostril, and during the process, doctors found a white hard mass inside the man's nostril. Clearly this was not a case of a deviated septum, as there was a foreign material causing breathing issues to the man. Dr. Khanna asked the man to immediately get a CT scan. It was revealed in the reports that there was a tooth growing inside the man's nose. Yep. You heard me right, there was a 14mm long tooth inside the man's nose. No wonder he had trouble breathing. Doctors claimed that they had never seen anything of this sort before, and even Drive Khanna was shocked. He diagnosed the man with an inverted ectopic tooth, which means that not only the tooth was in the wrong place, it was actually growing in the wrong direction. The man's tooth was growing upwards towards the skull instead of inside his mouth, and it caused many issues. The patient was in a state of shock as well. He could not understand what was going on, but Drive Khanna and his colleague Dr. Michael Turner ensured that there are cures for his condition as well, which of course included a small surgery in which the special visitor in the man's nose would be delicately taken out. This was done by oral and otolaryngolic surgery. After a series of careful surgeries, the doctors managed to remove the 14mm big tooth from the man's nose, and it is weird that the tooth was properly grown. But of course your nose is not the right place for it. The doctors managed to remove the tooth from the nose but left behind a 2-centimeter hole in the septum as well. The man was in pain for months if not years, and he had no idea what the reason behind all this was. His nose had a foreign material in it, and not in his wildest dreams did he think about a tooth stuck in his nose. According to many reports, it is common to find irregular and crooked growth of teeth and even pain due to such patterns. But a tooth growing upside down has never been seen before, even though the growth causes pain, numbness and even bleeding. This man had none of those effects, instead just breathing problems. That too due to the tooth blocking his nasal pathway. 3 months after the surgery, the man is doing great.